Narrator, picture this. An operating room buzzing with anticipation, and right in the center, a surgeon, let's call her Dr. Carter, dons an Apple Vision Pro headset. We are on the cusp of a surgical revolution. For decades, we've leaned on conventional screens and manual dexterity to navigate the human body. But now, extended reality brings a new dimension, literally. Imagine peering inside a liver tumor in real time, rotating it, mapping out the best surgical approach before making a single incision. This isn't science fiction, it's happening now. With spatial computing and real-time anatomical segmentation, 3D vascular structures superimposed directly onto the surgical field. Precision and reduced surprises? That's the new standard. Now let's talk safety, ethics, and regulations. With any transformative technology comes the responsibility of ethical deployment. Are we ready to trust an augmented reality headset in the OR? Safety remains paramount. Regulatory bodies like the FDA are evaluating AR in surgery, ensuring patient outcomes improve rather than compromise. Rigorous testing for image lag, calibration accuracy, and real-time tracking fidelity is ongoing. Ethical concerns about patient data, privacy, and surgical decision-making must be addressed transparently. Encrypted real-time data transfers ensure compliance with HIPAA and other global medical privacy regulations. But does this tech undermine the years of surgical experience? Critics argue that reliance on technology might erode the craftsmanship of traditional surgery. Does AR make us better surgeons, or are we simply outsourcing critical thinking? I see it as a tool, like ultrasound and robotic surgery, that enhances, rather than replaces, human expertise. Residents must still master fundamental techniques without over-reliance on digital overlays. AR-assisted procedures need proficiency validation, ensuring surgeons can operate with or without visual augmentation. One of the most groundbreaking aspects? Viewing 3D DICOM images in stunning 4K resolution. Instead of flattening a CT scan onto a screen, I can manipulate anatomical structures in space, providing a far more intuitive surgical experience. AI-powered segmentation and depth mapping distinguish between soft tissues, vasculature, and tumors, overlaying high-resolution real-time updates. This is transformative for complex procedures requiring millimeter-level precision. And training? It's a game-changer. Before, we trained on cadavers or watched surgeries. Now, with extended reality, residents can perform virtual procedures repeatedly, refining their techniques before ever touching a patient. Haptic feedback gloves and AI-driven simulations enhance this training, bridging the gap between theory and practice, creating a safer and more prepared generation of surgeons. What about cost? Time is money, and in medicine, time is lives saved. With augmented reality, we streamline preoperative planning, reducing the time from diagnosis to surgery. Faster workflows improve patient turnover, reduce delays, and bring significant cost savings for hospitals. Advanced cloud-based surgical planning platforms allow remote specialists to collaborate in real time, reducing consultation delays. The question is no longer whether AR works, it's whether we can afford not to use it. And the future? We're just scratching the surface. Imagine real-time image guidance with AR overlaying live blood flow, tumor margins, and critical structures as I operate. Advancements in AI-driven volumetric rendering and predictive analytics can anticipate anatomical shifts due to respiration or movement, dynamically adjusting overlays. Surgeries could become safer, faster, and more precise than ever. Budgeting for AR in hospitals? Absolutely. Just as we invest in robotic surgery and cutting-edge imaging, Arkansas should be an essential component of modern surgical care. The initial cost may seem high, but the long-term benefits in accuracy, training, and efficiency outweigh the investment. With modular hardware integration and software-based subscriptions for AI-assisted analytics, costs can be distributed strategically. It's time to advocate for its integration into standard surgical practice. In the end, surgery is about precision, skill, and innovation. These headsets are here to empower us. The question isn't whether we should embrace this technology, it's how fast we can integrate it, make surgeons more confident, surgeries safer, and solve complex anatomical problems with technology. The future of surgery is here, and it's augmented. End scene.